Also at the ESMO meeting was the highly anticipated CNS data from the ADAURA trial. So you remember ADAURA is a randomized trial with patients with resected non-small cell lung cancer, which is EGFR mutation positive, received either standard of care adjuvant chemotherapy or not, and then were randomized to placebo or 3 years of adjuvant osimertinib. The primary endpoint of the study was disease-free survival, and the study was massively, strongly positive with a hazard ratio of 0.17 for the primary endpoint group of stage 2 and 3A disease. Now, previously, when we've been looking at EGFR mutant patients in the adjuvant setting and the role of EGFR TKIs prior to osimertinib, one of the big problems we've had is progression in the brain. And indeed, in the previous RADIANT trial, when we looked at the EGFR mutation subset, we saw a big overrepresentation of patients progressing in the brain, patients that had been randomized to receive erlotinib in the RADIANT trial. And I think that was really significant. So the key issue is, does osimertinib prevent what we've previously seen? Now, the trial did report a huge reduction in the incidence of CNS progression from 10% in the placebo arm down to 1% in the osimertinib arm. And that is also coupled by a huge reduction in the distant relapse rate afforded by ongoing systemic therapy with osimertinib, with 33% distant relapse rates for osimertinib compared to 61% in the placebo arm. So osimertinib seems to have very good activity in that setting. One thing I think we need to still bear in mind is that patients did not have to have mandatory brain MRIs to go into the trial, unlike how we've been handling the brain in the field of ALK-positive disease. They didn't have longitudinal brain imaging built into the study, and only had brain imaging if they became symptomatic. So we have to bear in mind that sort of trial bias within the results that we see, because there could be other benefits or indeed no benefits that are not observed because patients had progressive disease but wasn't clinically symptomatic and therefore did not trigger brain imaging. But on the face of it, I think we're all really delighted to see this excellent intracranial activity, and it has massive reduction in distant relapse, which is really pleasing to see. And I think overall this additional data set reinforces the primary disease-free survival data set that has already been presented to date. It's just a shame that we don't have a little bit more granularity around what's going on in the head for patients with the lack of longitudinal dense brain imaging.